One of the factors contributing to worse health in men is the higher prevalence of cigarette smoking among males than among females at any age. By quitting the habit, males can reduce their chances of dying from any cause and experience a longer and happier life. So don't delay, quit today.
Avoid becoming totally obsessed by every changing statistic. You know, if we sit and watch every change, we're going to continue to become saddened, desperate, and hopeless. We need to be informed. We can't be the proverbial ostrich ignoring the situation, but we can look towards things more hopeful. Develop an attitude of gratitude. For everything and in every day, there is some reason to be thankful. And I'm thankful for the privilege of being able to share these thoughts with you, because as you may be thinking many thoughts that are similar to mine, we need to share positive and meaningful thoughts and options.
Good morning, and thank you for joining us for another episode of Defining Your Health. I'm your host, Tracy Lewis, and today we have another special presentation. We're going to talk about HIV and AIDS health and awareness. So I have with me a representative from the National AIDS Commission, Ms. Berndina Eck. How are you feeling this morning?
Hi, Tracy. I'm feeling excited to be here. Thanks for having me.
All right, so ATN, we're so excited to have you, our viewers. We want to invite you once more to like our page, share the link. Today's another special topic, HIV is an awareness. And I know as a church community, we're not going to especially advocate for sexual health in terms of safe practices, safe sex. We're going to advocate for celibacy, but we still need to have a discussion about the issue. All right, so today, we're going to talk about what's happening in Belize when it comes to HIV/AIDS transmission, the prevalency. What are we doing as a country, and how can we, as regular local citizens, help against this challenge? All right. So share the page, our YouTube audience. Thank you for joining us as well on Facebook. Remember, we're live. You can send us your questions, and Ms. Eck is right here. We're going to be able to answer them. So let's get right into it. So Ms. Eck, tell me about why you're here.
Well, Tracy, I'm here because I want to define your health as it relates to HIV/AIDS. I want to mention that as of recently, we had acknowledged or recognized World AIDS Day, December 1st. And the theme for that day, or this year's World AIDS Day, was end AIDS, end inequalities, and pandemics. And we are just here to talk about the reality in Belize.
Right. So I saw on the screen that you had a special presentation to ATN. And when did we celebrate World AIDS Day?
We celebrate World AIDS Day every year.
Every year.
For the purpose of recognizing what has the actual epidemic. It's a reality that's, affecting the world. It affects individuals, families, communities everywhere. It's more acknowledging the people who had passed away because of this illness, and recognizing the fact that communities locally, globally are making efforts to end this epidemic. And we need to see constantly where we're at to know where we need to go.
Okay, and that's every year on December 1st, right? So we're a little late, but you guys, you were so busy. You were so busy earlier this month, but we're glad that we're able to have you and to talk about. And you mentioned that it's an epidemic, pandemic. Right now we're in a pandemic, so everything, not everything. I think we're slowly winding down, or you know, um, not in terms of walking away,
Learning to live with the
learning to
pandemic,
live with the
yes.
pandemic, so that
COVID-19 pandemic.
right, so that we can recognize that there's still many other health issues that are challenging the people of Belize, and this remains to be one of them. You know, when I think about statistics, how prevalent is the
Well, Belize, honestly, the reality is here we're not doing well regionally. We're at 1.9 prevalence rate, and that's our adult population. We could talk about the different districts that are most prevalent, which is the Belize district, Kaya district, and Stan Creek district. And it's for various reasons that these areas might have the highest rates in HIV positive results. Mostly because in some cases these are decentralized places people can go get tested, so they're likely to have more statistics. And then the population size as well in these areas has influenced that.
Great. I want our viewers to see some of this information here with HIV and in statistics in our country. You said that Belize has an HIV prevalence of 1.9%. It sounds really low. So is that a good thing, or we can do better?
We could do better. Definitely do better. 1.9 sounds low, but it's not technically low regionally.
Great. So here I see that we have a timeline. You know, our prevalence rate is 1.9, and then you have a timeline started from 2014 where data was collected up until 2020 last year. And I think that it's been going well. We increasing, and I see a steady decline in 2020. Average recorded AIDS-related death is 110, but the cases that you have in 2020 is 130. I know that seems low, but is it possible? Is it because of a low reporting, or is it safe to say that this is we can take this as good news that the cases are
Good news
declining?
and bad news. There's always a shade of radar, but in this case of Belize, it's because of the actual COVID-19 pandemic. Last year, a lot less tests were done, so a lot less results were accumulated, and that is why we had people were in that whole phase of lockdown and everything, so people were more focused on staying healthy from COVID, and the testing clinics also had to kind of refocus testing for COVID.
Okay.
So yeah,
Right.
all of that.
So we have to take all of that in consideration, but we have been doing a lot in terms of um, trying to deal with the challenge of HIV/AIDS. So I want to go back to transmission. Okay, so we have the data that's showing us that it is a problem. We're working on it. We can do better. So for our viewers, many of us know already what are the modes of transmission. Let me quiz you. All right, I want to see the first person to put the transmission modes of HIV in the comments, and let me see how well we're staying in touch. All right, I know we have a lot of teachers here in this community. But walk it through for us one more time for all our viewers.
Yeah. So the main mode of transmission is through sexual activity, and it's through unsafe
sexual activity.
Yes. So as you rightly mentioned, we do promote abstinence, and if you know you are already in someone who's sexually active, just use protection. That's all we ask, because the entirety of today, I think, my message is to be that we have to accept that our personal behavior is what accounts for the HIV statistics in our community.
I love that. I love that. Your personal behavior is what affects this health issue.
Yes. There are a lot of risk factors also and social determinants of health that I could talk about here. And some of them are the circumstances that we cannot help, or certain people cannot help. And these are the circumstances we live by. And this is why we are here talking about this disease and promoting equality. We're hoping to end discrimination and provide the health services that are needed for people who cannot help the situations they're in.
Wow. You really hit me just now that this challenge that we're facing with HIV and AIDS, if each person were to take personal responsibility, then it wouldn't be such a challenge. I mean, the disease would still exist,
Yes.
but you taking personal responsibility is really all that it takes for us to combat this challenge.
Yes.
Right.
Then you have the issue with domestic violence, whereby some families go through a lot, and domestic violence isn't only physically hitting your partner. And I say partner because, you know, we have the LGBT community that it doesn't have to necessarily be a man and a woman, but definitely domestic violence can affect your economic situation. There is financial abuse, mental abuse, spiritual abuse, aside from physical abuse, actually sexual abuse as well. All of those things we have to look at when we think about HIV/AIDS in Belize or anywhere.
So your condition that you're in can also serve as a risk factor for easier transmission, and I think that's important. If you're in a relationship where there is abuse, that automatically predisposes you for an infection, because that person is going to act carelessly. That person is going to force. That person may be having other casual relationships.
Yeah.
So it's not just to try to work it out and see if it gets better. You are actually exposing yourself to other infections apart from the emotional and physical situation that you're in. Right. So majority of new infections occur between what ages?
Oh, that's our young people.
Our young people.
Ages 15 to 20 to 49. Well,
Okay.
that whole spectrum right
That
there.
whole-
Because this is the population of people who are actually sexually active. And I must mention it ranges from age 14, because statistics found in Belize, we found that women have their sexual debut, their first sexual intercourse, or they report at age 14, and men are at age 15. So we put that whole range there between 14 to 49, and we focus on this age, not excluding the rest, because some children are infected with HIV and older folks as well. But the focus is on these are the people who are actually sexually active and engaging. And of that, we find that of that age range, we find that women are more likely to go out and get tested and find out their status.
Women are more likely.
Yes.
And are they more, is it safe to say that in terms of cases of infected persons, persons living with HIV, they have the highest numbers, women?
Actually, no.
No.
These are the men. And men who do go get tested, they are the ones who are in, we find that have the prevalence, you know. And of those men, so consider all the men going to get tested, they are 2 out of every 3 men are men who have sex with men.
2 MSM, men who
Yes,
have sex with
MSM.
men. 2 out of every 3 men, and they are the ones that test higher for HIV and AIDS positive cases than women, but women are the one that are testing twice as much as men.
Yeah.
I think that's important for our men to know, because women, you more, it's a stigma. You assign sexual promiscuity to women a lot. And they're testing for HIV and AIDS, but you're saying that the data is showing that it's the men who have the cases that are climbing, and they're the ones that are not getting tested.
Yep.
What is because you're an oversight committee and you are it's a multi-sectoral agency, you collaborate with a number of other institutions. So what are some of the things that the National AIDS Commission is doing, particularly to reach the young people as a target population, and these more vulnerable or predisposed groups? Because as you mentioned, more than half the population, they're under the age of 20, they're young people.
So some of the things are, we're planning as of next year to implement our new grant coming from the Global Fund. We plan to scale up testing. We have right now in Belize, unfortunately, 2 gene expert machines. Those are the machines that are used to actually do the HIV test.
What's the name of the machine?
Gene expert machine.
Gene expert. Okay.
And we have, of those 2, one was working, and that machine is used for testing HIV/AIDS, COVID, and TB, tuberculosis. And the focus had been on COVID. So we have recently gotten 2 more. And in the next few weeks or in a month from now, we should get 7 more so that each district could have their own gene expert machine. And that relieves the issue whereby people would have to come to Belize from maybe down south just to get an HIV test and wait for the results. So we are trying to focus on spreading the machines, in throughout the country so that people could access their actual results.
I think I saw a couple pictures with there's a schedule or there's a special day when you guys have testing that's being done or promotional days, or you can just go into any healthcare institution and ask to get tested.
We have different clinics with Ministry of Health. Of course, you should as a Belizean or any person going to a clinic and be able to ask for an HIV test and get that test. Even if it has to do with a referral, that clinic should be able to refer you to your nearest clinic. And so it's important for me to add that also the Belize Family Life Association also does testing along with the CSO Hub, the Civil Society Organization Hub. That entity is an organization which houses or groups or help coordinate different CSOs throughout the Belize country. And you could get your tests done there as well. That's in Belmopan.
And do we have a high rate of testing from population? Do you think a lot of people go in to get tested? What does that usually look like? What are the numbers saying? Like for the month or on a regular basis, do we have persons that come in and get tested, or it occurs like when you go for a general checkup, then
you could request, and then it varies like monthly. So it's something that we encourage, hence I'm here. And we want more people to get tested. I think our numbers aren't that well, so that's why we need to push the matter to get people tested, specifically men.
Specifically,
yes.
All right. So we're speaking to our men this morning. Remember, if you have questions, you can just put it in the comments. Ms. Eck is here to support us. Why is it that men face a higher chance? Because is it because they're likely to have more sexual partners?
Yes. Our reports coming up from the Human Rights Commission and this different statistical agencies, which we get data from the Ministry of Health, and we compile all that together. We found that men report that over their lifetime they have about 7 partners throughout their lifetime, as opposed to women who reported they have at least 2 partners.
That's Belizean statistics?
Yes.
Because it sounds like the numbers sound a little low. I'm not trying to be.
Well, that's what we have, yes.
Because that's over the lifetime, right? That's not right. So we need to do better. And I just think that I have to say that it's a terrible experience, right? You go in, you get tested, and they tell you that you're positive for HIV or AIDS. And then I have to go back to the biblical not warnings, but guidance, because first of all, it goes back to being personally responsible, holding out, abstinence, and all of that. And then when you do get married, you stay with one partner.
Yes.
So all of these things assist with not being able.
And then I know you mentioned that you think you're late in terms of our coming on and talking about this, but honestly, to me, in my opinion, I think World AIDS Day is every day, because every day somebody new gets a result, and that is their World AIDS Day or World HIV AIDS Day, and their world is changed. And honestly, in my opinion, to end or to become, because we could address this, if you are adherent to your ARVs, because as you get tested, we are one of the issues, one of the goals is that we're planning to have people referred that are positive immediately to HIV treatment, and that's within 7 days. That's already happening. So we don't want to lose them in between that date they got their results and holding them off. We make immediate referrals, and with that referral, we get to let them understand what are the situations going to be like, and let them know that it's not a death sentence. I know that's a cliche line, but the reality is, once you're adherent to your ARVs, and once you commit to lifestyle changes, meaning your diet, your alcohol, substance abuse, I don't know, maybe you experience all of that. your mental health needs to be addressed as well, to accept this. And if you know you have that support, and this is why we're here talking to the community, we need that family support, we need that community support, and that addresses stigma and discrimination as well. That the reality is that it's something difficult to accept, but it's not impossible. That if you adhere to your ARVs, you could actually have your viral load suppression could be very low until it's undetectable, meaning the virus in your system could be so low it's not detectable.
So ARVs, you're referring to?
Those are the medication you take when you know that you're diagnosed or have tested positive.
Right. So it's not the end of the world. It's not a death sentence. But I love that you said that we celebrate World AIDS Day once a year, but every day is World AIDS Day for that one person who received the results, and how it must feel to experience that this is something that's going to be with you for the rest of your life. It's not going to be a death sentence, but it's something you're going to have to live with for the rest of your life. So we always say that prevention is better than cure.
Definitely.
And in the case, that's why we advocate for prevention, abstinence, safe sex. But in the event that it does happen, you can look forward to support. That support depends on your mental health you mentioned. Do we have a problem of stigma and discrimination in beliefs when it comes to HIV and AIDS?
Yes, I think any level of stigma and discrimination is a problem, because it basically excluding. So even if it's one person being stigmatized and discriminated, it is a problem. And that one person, there's a lot of people out there being thinking or feeling that they're being discriminated, when even that's not the case, but they feel that. So we just have to end the idea and assure people that, this is the reality. We are here to care, and we could also, that's why when we make that referral, we have social workers, counselors. You need to make that working relationship with your doctor there. And it's honestly the truth. The thing is that we find that the doctors don't necessarily have the time because of all the work, with COVID and everything, and doctors being busy. But make that relationship with your healthcare provider, your social worker. There is help out there. Seek the church. Have somebody to talk to. And if your family is not supportive of your issue or your concerns at that time, find somebody to talk to, because it all leads to mental health, community health, global health.
I love that you went back and you said seek the church, because the reality is, in many of our churches, we do have persons living with HIV and AIDS. I don't know if you really sat down to think about that, but in the same way that we have hypertensive people on dialysis, we have persons living with HIV and AIDS in our church communities. And what are we doing to help support them, to assist with mental health, to create a safe community where they can still interact and have recreation, and they don't feel the need that I have to keep this a secret, because that's what compounds the issue.
Yes.
When they're not confident to let others know their status, which would help to tell other people, right? So I'm really glad that you mentioned that. When it comes to stigma and discrimination, you spoke about mental health, but does it actually have an effect on their physical health?
Oh, definitely. It's all connected. You have, just imagine a person being depressed or sad for the day. They wouldn't want to get up. They wouldn't want to even see anybody. But the moment you decide to not want to get up or can't get up, you find that you're home, and then that saying that says a body in motion stays in motion.
Right.
Get out. You need that fresh air. And some days it's very, very, very hard for the average person. And it's basically mental health. You're not getting up to get your physical health in check. So yeah, it's connected.
I have a family member who suffers with HIV and AIDS, and it's I have seen the highs and the lows, and I have seen that when that person is on their medication, taking their ARVs, they're great. They look better than me. They already look quite healthy. But there's a lot of times when that person just actually looks like something is affecting him, and it's pretty easy to fix, because as soon as they're on their medication again, they're fine. It's not like earlier when when it was a great big boom and we were all worried and people looked and they had the sores, and then as soon as they had this particular feature, you knew that they were affected by this. So I think it's important for us to remember that stigma and discrimination actually affects not only their mental health but their physical health, and it's self-destructive, right? Like you said, you're not able to go out, enjoy yourself. You don't even want support when it does come knocking on your door, right? So I'm glad we're having this conversation. During our break, we want to share a video with you, a testimonial from
Skim.
Kim. All right, she's a person living with HIV and AIDS.
She's a person living with HIV/AIDS, and we featured her because she was very willing to talk to us, and I hope we could spread awareness through her testimony.
Amen. All right. So thank you for joining us so far. Defining your health. We're talking about HIV and AIDS health and awareness. So stay with us. We're going to hear from Ms. Kim. I'll be right back.
I'm a single mom of two, a boy and a girl. I love to dance. I love listening to music. I love being with my family. My name is Diane Jones, and I'm a Belizean living with HIV. I got infected from my ex-common-law, who was infected before me and did not tell me anything. It was this one day in December of 2017 that I went out to town, me and my daughter, and they were doing free testing. And I was sitting there waiting for the result when one of the nurses came over and she said, well, you have to go to the hospital because you're positive now. And I was like, what? Because I'm a person, I don't believe too much in what people would say about me. I don't care about that. Whether you want to be my friend or you want to come around and visit me, that's up to you. I had a brother who was HIV positive, but he was an HIV patient for 9 years who neglected himself and refused to take his medication. I would like to advise everyone living with HIV, if you're breathing, if you're eating, you're feeling, you're walking, you're talking, please go and take your medication, because a few months or a year or two down the line, you don't want to go through and feel a lot of pain. And I'm saying this because I had to live that moment with my brother. I believe that there are lessons we could learn from COVID that we could apply to people living with HIV. I would like to see people living with HIV being at peace in the community, and I would like to see people just totally stop discriminating people like us that are living with HIV. I would love to see that everybody would be like one people that we are, because we are all human beings and we need to be treated as such.
It's here.
It's here.
It's finally here. Adventist Television Network is here. The one-stop network for Christians or anyone wanting to learn how they can develop a more meaningful relationship with Christ.
Tune in to Central Cable for daily programs on health and wellness, current events, relationships, spiritual growth, and of course, musical praise, all catering to our local urban audience.
The book of Revelation depicts God's people as flying in the midst of heaven as angels, proclaiming the everlasting gospel. ATN will allow you to reach the world with God's message and reap the harvest. But more, it will help you to grow as a disciple. It will keep you connected with your church. Above all things, it will prepare you to meet Jesus when he comes.
ATN is a non-profit initiative. If you want to do your small part in reaching people with the good news of Jesus, you can partner with ATN by offering your generous tax-deductible gifts. Adventist Television Network is an official partner of 3ABN's Dare to Dream Network. Keep up with special services, programs, and events brought to you by the local Seventh-day Adventist Church on Central Cable and streaming on Central Believes Mission Facebook and YouTube pages.
Brothers and sisters, we are looking forward for your financial support to the Adventist Television Network.
ATN and Dare to Dream, the urban Christian lifestyle television.
back to Defining Your Health. I'm your host, Tracy Lewis, and I have with me Ms. Berndina Eck from the National AIDS Commission. We've been having a really good conversation about, the general condition of HIV, AIDS, and awareness in Belize. And we were talking just before we left about stigma and discrimination and how it affects and challenges persons living with HIV and AIDS. So I know you guys do a lot to promote and push for our audiences not to approach persons with HIV and AIDS, stigma and discrimination. So I saw a number of campaigns that you guys are running on your Facebook pages to show that you don't support stigma and discrimination. But what are some of the ways that we do? Like, I can safely say that I don't stigmatize persons, but how do I show it? Like in real and live action, how do I actually show or what do I do, or what do I not do? I mean,
Well, there are various ways. The first, we found that the statistics coming out of the different database that we have throughout Belize, meaning from the Ministry of Health and so forth, people do experience stigma within their own families. They're shunned away from their homes, their communities. Some were even their churches, unfortunately, and we find that stigma also happens at the workplace. Either they were released from their place of employment due to their status, or were not hired due to their status, and that affects labor laws. So we have committed at the AIDS Commission to look at issues in that area as well. And then people found or stated, some of our persons coming in to get tested, they say that they were stigmatized within the health system as well. So we need to end that there as well. So we look at all those aspects. And then I know in certain applications, when you apply for maybe say for a visa, we are asked to present our HIV status before you enter a country. Just like how now COVID, you have to present your COVID status. The stigma is there. Maybe they feel that they are not going to be able to enter that country or get a visa based on their status. So people are less inclined to get tested because of those requirements based on people requesting them and needing a job or being declined a job.
I wonder, maybe we don't have the data, but I wonder how many persons living with HIV and AIDS actually are employed. I mean,
I think we have the data. I don't have it on me right now, but definitely that would be something I would get back to you with.
right, because then it must be really challenging. Not even, let's say that the discrimination wasn't a challenge, but for them to even get back into the workplace, because of, I don't think in 2021, and maybe this is just an opinion, it's unfounded, but I think we're more accepting
Yes.
of HIV and AIDS than we were initially.
Yes.
So I would hope that because of this shift in the mood, that more persons are getting out there, they're applying for their jobs, they're still having fun, they're showing up to places, which is fine. It's just that they need to be responsible as well. So we hear all the time about what we need to do, but what is being done to work with persons living with HIV and AIDS, to help them understand how to be careful. Maybe you're watching and you're living HIV and AIDS. How do you ensure that you're protecting yourself, taking care of yourself, and that you're protecting others? So what does the interventions or the promotions, or what does it look like for that particular population?
Okay, so whoever you are going into a health agency, getting your test results, and you find out that your result is a positive result. Immediately, as I mentioned, you get that immediate referral to get services and treatment right away. And that is without question or anything, because we need to get you in the system. And the faster you get on your treatment, the best for you. And it's up to that individual to adhere. And of course, that comes with support, counseling. We have some entities that have social workers on hand. And if not, your healthcare provider should be able to make a referral and follow up with you where in whatever means, and to ensure that you're on what we refer to as the treatment cascade. And that's where I wanted to get into the global goal in terms of treatment, adherence, and viral load suppression.
Okay, what do you call it? The global?
Okay, so Belize is one of the United Nations that has committed to participate or continue the UNAIDS global goal. This is 1990 goal, whereby
let me see. I think we have that on screen.
We have agreed to, and this goal was to have been met in 2020, last year, but we found that many countries in the UN hadn't met the goal. And essentially the goal is to have 90% of the population in the country that are infected with HIV/AIDS know their status. We don't want to omit anybody. We want 90% of the people who are positive to know that they're positive and aware. And of those 90%, we want 90% of that population that knows to be on treatment and adhering to their treatments. Yes.
So what? Okay. All right. So we have it on screen then, the UN AIDS 1990 goals. So 90% to be diagnosed, 90% on treatment, 90% of all the cases we know
Mhm.
virally suppressed. But what will this goal essentially do? What are the implications of these goals?
That would help to reduce our prevalence of 1.9 to much less.
Much less.
As I mentioned, you think it's just because it's one, it's a lot less, but no, one is a big reality for us. So in Belize, our reality here that we are estimating right now that as of 2020, 5,504 people are positive in our country. This is an estimate because we don't know. We need people to come out and get tested so that we could have a better estimate. And we see that 52% of these people actually know. Now, this graph that I'm showing, or should be showing, the second
Can we
graph,
see the graph?
we haven't even met the 90% of the population that we are estimating knowing their status. You
And
understand?
that's an estimation because we know
Yeah.
that more than likely there's more cases that we haven't.
Yeah, maybe somebody will get infected tomorrow. Hopefully not, but that's the reality. People pass away. And I must mention that people don't necessarily just pass away from HIV/AIDS. They have underlying conditions that contribute to this. Just like with COVID, if you have other illnesses, that makes you more susceptible to any other thing, and your likelihood of becoming much more ill would be affected. So then it goes on to that less than 90% here in Belize are on treatment. But
90% of the known cases in Belize are on treatment already.
no,
That's the goal.
that's the
Do
goal.
we have numbers of where we are now? How many are on treatment now?
Yes. Yes. So we have that here. If we would show it on the
Can we show the chart of
Screen?
where we are?
where we are, yes. Our reality is we have only met 52% of the population knowing their status, and 53 of that percentage of that 52% are on treatment, and 38% are actually virally suppressed.
So what's the difference with being on ERTs and virally suppressed?
All right, being on ARTs, which is the antiretroviral therapy, is basically taking your medication daily, adhering to your treatment, making sure you meet your lifestyle changes, whatever it is, your diet, taking care of your mental health, your physical health, what have you. And these all, as I mentioned earlier, they're connected. That will eventually lead you to the virus in your system to be undetectable. And undetectable is being virally suppressed.
All right. Okay. That's good to know. I think that's a great goal. So the UN AIDS, this is going to launch when?
This is in effect as of before 2020. We hadn't met the goal last year. That was our deadline globally. So UNAIDS, we had agreed as United Nations that we will continue until 2025.
Right, great. Do you guys go into different groups, or you have to ask to be invited? Like, do you make it a point to reach into different communities, like our church community, for example, or a particular villages, and then you just post these types of information sessions, or what is the advocacy like in terms of information
Okay.
sharing? Because I know that you have several branches under the commission.
Oh, yeah.
Particular the one for education.
So that's our subcommittees. I think you're referring to. We have a committee just for promotional awareness and messages, meaning our statistics that comes out, it's supposed to be accurate, up to date, on time, because you don't want till 2023 you get 2021 results or statistics. So in terms of going into communities and educating, we find that at AIDS Commission we promote whatever our subcommittees are planning, because the National AIDS Commission do have subcommittees within the different districts. And we try to support them as best as possible with whatever initiative. Maybe if they want to have a testing day at a random day, definitely put that out to us, and we'll support you with maybe a little pens or snacks for the day or what have you. Set up your station and get those testing done so that we could get our results in. And of course, we encourage and support the CSOs, meaning the civil society organization. We work with the Belize Family Life Association, who actually go out and into the community and have closer relationships with the people out there who may be infected with HIV/AIDS. So in terms of the National AIDS Commission, we don't have individual clients. We work with organizations who are most likely, or like more than likely, our partners, we would say, not clients to us. And we work closely with the Ministry of Health and the different government ministries. Actually, we have been.
I want to see some pictures on screen because we have quite I think I saw some pictures with trainings, with people promoting the World
World
AIDS
AIDS Day.
I saw your your director, Mr. Enrique Romero, doing presentations. He was supposed to be with us here today,
Yeah.
but busy guy. So this is a lovely team that you have. This is your team, right?
Actually, the team, yes, anybody in Belize who actually partakes in the response to HIV/AIDS is our team member. At the National AIDS Commission, we are the secretariat made up of 4 people on staff. But we encourage anybody who has something to do with the response to the HIV/AIDS situation in Belize, reach out to us. Let us know how we could support you. You do have a part in the national response, and we want to bridge that gap. Invest any way we could support you. So if you're like any entity, any NGO, and then we're also making calls to CSOs. Once you know you're working with a minority population, whether it be immigrants, people with disabilities, elderly, and you know that you could impact the HIV AIDS response in Belize, contact us and let us work together.
Awesome. I have one bit of information here before we leave that I wanted to ask you about social determinants and risk factors.
Yes, my favorite thing.
Why is that your favorite?
No, because as I was mentioning earlier, the circumstances that we live at, we have in Belize, they're different for everybody, and we basically, as I was mentioning, the issue with domestic violence, gender-based violence, all of these health concerns, your poverty situation. If you are in poverty, it leaves you less likely to access health services because you're focusing more on surviving. You might be sick today, well, I don't have time, I don't have money to go to the doctor. You want something to eat, so you would put off your health to actually meet your more immediate needs. So all of that,
those are structural
snowballs.
problems.
Yeah.
We have a personal responsibility, but I like that you mentioned some of those some key conditions like poverty. That's at the structural level where the government gets involved to ensure that people have access to healthcare. They're not just spending all their time trying to eat and breathe. And I think it's important that we recognize that, because I was going to ask you, in comparison to countries with lower prevalence rates and transmission rates, what's different? Is it because we are a Caribbean people and we're vulgar and loose and on and that? Is that partly the reason why we have higher rates? Because that's, I don't know if that's a stigma or a discriminatory thing to say, but is there any relationship between saying that?
Yes and no. It is structural. I don't think it's a stigma. It's our circumstances as a Belize, as a society here in Belize, and this is why we're here, trying to get these resources, working together as entities, and us at the National AIDS Commission making a call to the community to come together, partner with us, and see how we could address these, or at least establish a level of comfort to the HIV/AIDS population.
Great. So you're talking about comfort. I notice here that we have a number of persons in the leads who are aware of all this stuff that we're mentioning. We're here, we're advocating, but the data is telling us that over 90% of women in Belize have heard about HIV and AIDS. Can we have some of this information here? Right.
This is our general knowledge. Yes, we did found that in our statistics, people do know about HIV/AIDS, and it's basically, as I was mentioning again, up to us to actually make our choices. Just like with the COVID-19 pandemic, people know the protocols. People should be adhering. Know to wear their masks. Know to social distance. Know to not being gathered in crowds. But do they do it?
Right. So it comes back again.
Yeah.
Personal responsibility. Yeah. This is a touching. It's not a touchy topic anymore because it's something that has been around for a while. Can you say that all the plans, implementation, strategic stuff happening in the future. And can you foresee that Belize eventually is going to get to that place where we have lower numbers and it's not a concern anymore?
I think that's the mindset that drives me every day. I don't see us going any worse. And you have to accept the fact that you are dealing with people or working with people. People have their own ways of behaving, but I always have hope that things will get better. And that's why I'm here. That's the purpose. I don't wake up thinking, well, tomorrow it will be worse. Just go to work. I come with a purpose.
So you're not technically new at the National AIDS Commission, but you mentioned that this is a love for you and that you enjoy working there. What is the experience like working to assist people? You're not necessarily in the field.
I am on the field, yes, but not that direct contact. I am, as we mentioned, the oversight, monitoring, and evaluation officer. I basically help to oversee the national response, helping to provide insight as to how to improve maybe that client contacts, how information is flowed. I meet with the different agencies that provide HIV services. I work with the Ministry of Health, BFLA, CSO Hub, and whoever I would be able to meet with. I also partner with the Hand in Hand Ministry as well.
Right.
Well, not me, but the National AIDS Commission. And I go in these places and I look at their plans and I help to oversee that, we're meeting our targets. We have indicators that tell us what guides the grant. Every year, every quarter, we have a schedule of events that we're supposed to get done so that we meet our targets, and I help to oversee that.
Great. And you said you have a schedule of events, and I love that. I know that you're doing a lot of different things to promote HIV awareness and health and all of that. And so it was really great to have you on set with us, Ms. Eck. And I want to ask our viewers if there's anything you think that we failed to discuss in terms of at this level, as an institution, as a National AIDS Commission, what you're doing, what can be done outside of that. Are you a person living with HIV and AIDS and you have concerns? I want to put on the screen for our viewers so that they can see the information related to where can I get help? Where can I find answers? Who can I contact? So that, like you said, every day is World AIDS Day for somebody.
Yeah.
The information is out there. But where do I go? Who do I contact for the very, very first time? The actual information for the National AIDS and Committee.
And if you don't know, we do have the NAP app, the National HIV AIDS Services app that we had launched on World AIDS Day. I think we will have it available for Android. I know it's for on iPhone right now, but it's basically an app that is downloadable and have all the questions that you might have as a person curious about maybe your status or knowing more data about HIV/AIDS. Download that app and you could get immediate access and links to other entities that is readily available within the national response or anything pertaining to HIV/AIDS.
Great. All right. It was a pleasure having you, Ms. Eck. And is there anything you would want to leave our viewers, knowing that it's a Christian community and we're not necessarily going to change in terms of doctrine of promoting safe sex?
I understand.
Is there anything you think that would help our community, and not only those who do not have HIV, but persons with HIV as well?
Well, I know as a Christian community, we do help pray for our communities. We work on a love basis and just help to stop discrimination, because I don't think we as a Christian community discriminate, but promote that love, establish that sense of security. For you don't know anybody's situation out there. Nobody walks around with their status on their chest or anything. So just continue treating people with kindness.
Right, and you said that as a Christian community we don't discriminate, but I want us to be careful because we also have a tendency sometimes to judge, and generally the population, the person has AIDS, that's because they were asking for it, they were irresponsible.
Yeah.
And sometimes it's not because they were irresponsible, but even if they were responsible for it, they made bad decisions. This is the reality that exists now. What are you going to do about it? And how you treat that person and the situation reflects more on who you are rather than the person. So again, it comes back to that spirit of love, forgiveness, and understanding,
Yeah.
because it's really easy, and we're tempted sometimes as Christians to, it's their fault, you know, they put themselves in that situation. They know what they should have done, and as a
Yeah.
Christian, they should have known better.
Mhm.
You know, but it goes back to coming back to that place of love.
Yeah, and then think about our statistics. If you want facts, our debut for men and women, sexual debut is age 14 and 15. At that age, you are not legally consenting to sex. So you have to think about the aspect as well. And somebody who has been somewhat abused, or not somewhat, but really abused with sexually, are more likely to be, no, you don't want to say promiscuous, but
Promiscuous.
that's the reality. And
It does happen.
that takes a toll. You at a young age being taken advantage of. Imagine your sense of worth, your sense of purpose. It could lead your mind all over the place. You don't have that support at home. You think that you're, discarded, and you're not there. Like, your heart is in the right place, but your circumstances was just not playing out well for you.
Right. But there's hope. Like
Yes,
you
yes,
mentioned, it's
definitely.
not a death sentence.
Mhm.
There is hope. And we have a host of other institutions and partners that work in conjunction with the National AIDS Commission. So thank you for joining us this morning. We had a wonderful time with Ms. Eck.
Thank you.
And hopefully we can come back and do something again another time. Our viewers, you're always free to leave your questions in the comments. Thank you for joining us on YouTube as well. This is Defining Your Health. And I hope you enjoyed this session.